Welcome to learning about high blood pressure. And tonight we're going to be talking about tips and tricks for the holidays. And we're going to be answering your questions. So if we get time tonight, you can certainly post them to the chat. Let me introduce Dr. Christina Miller. She is double board certified in emergency and integrative medicine. She's also got a laser focus on nutritional science and totally supports lifestyle medicine with the focus on health promotion, not trying to deal with illness, but health promotion. She's now currently at Plant-Based Telehealth and is certified in 23 states. Unless that's changed. Has that changed, Doc?
Not yet, but I'm working on the 24th as we speak.
All righty. You can connect with her and find her at plantbasedtelehealth.com.
Thanks, Jean. And I get the honor of introducing Jean today. Jean is the co-founder with Dr. Deborah Shapiro of the Pregnancy Advantage, and she works tirelessly. I swear no one works more than Jean, one-on-one with patients to educate them on living plant-based. You can connect with Jean at www.simplyplantbased.net for a plethora of information. There is so much information there. So if you haven't checked it out yet, please do so. And you can learn more about her programs and get all these free resources like cooking videos, recipes. She has a YouTube channel, Jean Shumacher, Simply Plant-Based. I hope you guys will check her out.
Thank you so much, Chris. And I just want to let people know that we're here. We're just having conversations for educational purposes. Always check with your doctor before undertaking a new health regime. Just if you're changing anything on it, you need to talk to your doctor first. So
yeah, this is just a chat, just a discussion, just general information, but you guys have every single person has specific needs, and if something's going on with your heart or your kidneys or your blood vessels, we don't know about that. So you may need those medications, even though we may say something about medications here or there. So please do work with your doctor. Take this only for educational purpose and do your own research and make sure you're doing the right thing for yourself with your doctor's help if you're on medications.
Right. Absolutely. Well, tonight we're going to talk about, because we have holidays coming up, for everybody, regardless of what religion you are, you're going to be inundated with parties. You're going to be dealing with family. And there's the stress of that, of making it the Norman Rockwell, Christmas party and, dealing with relatives and stuff like that. Some of your relatives you have to love from a distance, and you get to see them once a year, at Christmas. And so, we wanted to talk about some of the tips and tricks because that can be very stressful. And that is something that is not a good thing for your, high blood pressure. So we're going to talk about a couple of tips and tricks and things to talk about tonight. The first one is, I love this one, is to call ahead to, if you're going to a party, who's ever hosting the party, just call ahead and just say, what is going to be served? Can I bring a dish? And usually I bring several dishes because, my, needs for food are very different than most people. They're, especially around the holiday time, it's the time of indulgence, and it's that, you got those recipes, the cookies come out. Oh my God. And I started looking at some of my mother's old recipes. Like, there'd be like a stick of butter, like 2 cups of sugar. And it's like, what? I mean, when you start to look at some of these recipes, you're just like, wow, there's a lot of animal products, a lot of sugar, things like that, that are just going to hit our systems and are not going to be good. So if you can call ahead and bring, ask what you can bring. So, make it something that is going to be health promoting. Like bring a salad. Everybody likes a salad. You can bring a health promoting dish like that. My husband and I usually bring, it's called a mini hot logic. Have you ever seen that, Chris?
Mm-mm.
So it is a warming tray, and I put my food in glass dishes. So I'll make up a plate for my husband and myself. So as soon as we get to wherever we're going, then in a corner, I'll just plug that in. And then when we go to sit down to eat, I'll have that because it's hot. I like a hot meal, and I don't have to bother anybody. It just makes it really super, super easy to bring that and bring a dish, and I have that, and I can eat a salad, usually bring a dessert. That works really well.
Nice. Yeah, this is such an important topic, Jean. I'm glad we're talking about it because the holidays can derail people. And what I've noticed about myself and so many people out there, many of my patients, is that it's not just about eating one cookie. Like, yes, that could derail you quite a bit, but it's not just that. If you eat one thing or if you start eating a little bit of sweets, it can often set off your dopamine receptors and your food addictions. And then I mean, I'm sure there's people out there who are like me. After I have a little, I want more. I want more, I want more, I want more. And suddenly the health is out the plan, right? It's the old adage, like once you've had one, well, you might as well just feast on it because you ruined your diet that day. So just go crazy. And so I strongly urge people to not have one. Don't even have any at all. Like really, really, really important to be strict with yourself. Yes, maybe one won't kill you, but don't go there because it'll set you into a bad downward spiral oftentimes. So what the tip that I want to share though is to make a plan. And literally without a plan, I feel like we're going to fail. And there's a quote that goes, fail to plan or plan to fail. So you have to make a plan. So for example, you're going to your grandma's house or your aunt's house and they're making special cookies that you love that they make for you every year. What are you going to do when they say, here, I made this just for you? What's your plan? Have a plan in place. What are you going to say? How are you going to handle it? Are you going to call ahead like Jean suggested? Or are you going to say, no, thank you. I'm working on a plan for my health issues to lower my blood pressure or whatever. I would be prepared for that. Be prepared. What are you going to eat when you get there? And there's the fondue that you love so dearly. How are you going to navigate that situation? Right? For me, I'm going to stay out of the kitchen. I don't even want to see it. I'm probably going to eat a bit before I go. I'm probably going to do what Jean said and bring some food so that if I feel like I really want it, one, I'm not even looking at, I'm staying away. And two, I'm munching carrots and some hummus that I brought. Right? So I have to have my own plan, or I likely will be at the fondue station feasting on it accidentally and back on plan tomorrow, right? But that's not what I want. So really it's important to think it through where you're going, how you're going to handle that situation. I know that's gotten me out a lot of pinches before.
Well, I loved the comment you made about eat before you go, because this is one of my biggest ones. Because for me, my Achilles heel is potato chips, in particular, Cape Cod potato chips.
The local brand, huh?
Oh, yeah. So, I can't even go to the factory because it would just kill me. But, I don't buy them. They don't come into my house because the oil and the salt are going to raise my blood pressure. No ifs, ands, or buts. And I know this. I know this about myself. I know this, that it's going to have this effect on my body. But it is hard when I'm staring at a bowl of, Cape Cod potato chips and everybody else is eating them. Everybody else in the room is just, pounding them down and dipping them into stuff that is going to cause you issues without question. So one of the things that I do is I'm eating right up until literally like we're pulling in the driveway and I'm still eating carrots, like you said, carrots, hummus, things that are extremely filling to me, that I walk in and I can see that potato chip bowl. And I'm like, you know what? I can't even put one potato chip in there. Like I'm that full because that way I'm not tempted. Because if you're hungry in the slightest bit of hunger, you can talk yourself into anything. You can talk yourself into it. So I know, and I'm the first person to go, hi, I'm Jean Shumacher. I'm a food addict. So, and I am. So, and I just know that about myself. So I bring an hors d'oeuvre, an appetizer that I can have that will give me the crunch of a potato chip. And then I have usually some kind of dip that I've made to go with it. And I get those Edward and Sons. They have those rice crackers that have no oil and no salt. So they're going to be higher caloric density. But you know what? That's the least of my concerns right now. And it's the salt and the oil and the animal products that are going to raise my blood pressure without question. So I eat before I go. I have some, big thing. And then along the way, because it's never close to my house, wherever I'm going, it's, several hour trip. So I'm eating carrots, cucumbers, celery, dipping it in hummus, just so that I can be full, literally. So how about you?
That's a good one. I like that. And I often do my green smoothies and I'll drink it right before I go too, because they fill me up. like to the point that I can't eat anymore. And so I'll get there and I'm not hungry. And or if I'm in a pinch, I'll grab an apple. Apples really, they always satiate me. So I never go anywhere hungry, like ever, 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 because I'll be starting to crave her. And even if I survive that moment at their house, I find I come home and overeat because I was hungry and I was thinking about it for too long, and then I still end up overeating. So even though it's healthy food, that's not what I want to be doing, is overeating late at night. So yeah, I agree. I like that one, eat before you go. And I have another one. So when you're at family's house and you feel like you're standing out and people are kind of looking at you funny, what I've learned is it's best not really to talk about what I'm doing unless people are interested. So I wouldn't assume everyone is interested in what we're doing, and in that way, we don't want to be the annoying person who's talking about our health and our diet and how great it is and blah blah blah. So I don't talk about it. I leave it. If someone asks me, then I do. If they're interested, then I will talk about it. But if they're not, I kind of lay low, because it has definitely caused conflict, I've noticed over the years with my family. So I don't talk about what they're eating, and if they aren't interested in what I'm eating, then that's fine. We're there to see each other. We're there to, I'm trying to be as healthy as I can be, and we focus on that. Our relationships together, our time we get to spend together, the joy of food. And even though it's a little different, that's okay. They choose what they want. That's okay. I choose what I want. That's okay. Like, without judgment of each other. I'm not judging them because I think it's not healthy. And and a friend said something to me recently. She said, just do you, instead of like, I don't have to justify why I'm doing. I'm just doing me. This is what Chris Miller eats. Like, who cares? This is what I wear. No one's judging what I'm wearing or how I do my hair, but why would they judge my food? I'm not going to be so self-conscious about it anymore. And that's really helped me over the years, so that I can go now and I feel comfortable with what I'm doing. I don't make a big fuss of it. And I focus on my health purposes. This is too important to me to ruin it with one evening. So anyway, that's helped me over the years.
Yeah, because your health is worth working for. No ifs, ands, or buts. And we've talked about this on numerous occasions, that you have to get to the root cause. The high blood pressure is just one of the symptoms of something underlying. You've got to get to the root cause. And, part of it is your diet, without question. Part of it is the overload of toxins that you're being exposed to. That's another piece. But another big piece is stress. And so one of the things you need to learn how to do is to work on reducing stress in your life, because we're all, especially around the holiday time, we do have a lot of stress. So there's a lot of different techniques out there. We've talked about some in the past. I love my respirate, meditation, yoga, whatever works for you. And you need to do it, because there's nothing worse than having to deal with Uncle Henry and all the crap he said about you over the years and whatever. You just don't need that. So you just go, Uncle Henry, it's so good to see you. I'm so glad you're alive and still kicking, still rather feisty, and move on. And go on to somebody else. But just learn to anticipate, like Chris said, have a plan, but you need to be working on your stress. So focus on the family, of the time. This is a holiday season. You never know how long we have on this planet. So it's a time to cherish your friends and family at this time. It can be a very lonely time, and do reach out if there's other people that that are out there that don't have anybody to go to or be with, on these days, these holiday days. Please reach out, because it means a lot to people. It really does. So
yeah, that's a great point. As far as reducing stress, I feel it for sure, and it definitely affects my health and affects my sleep, and I feel all that. And so I force myself to do at least 5 minutes of quiet time every day. I just call it quiet time, and I just sit quietly and just close my eyes and just breathe, or just take quiet time. Yes, it's maybe a meditation, but I also just call it my quiet time. And that it resets me, so that I'm not so hyper later on or so quick to react. I can more take a step back and be calmer. So my quiet time is important. But along those same lines, sometimes with the holidays, as we get busier and busier, one of the things that we forego quickly is our exercise. And so It's so crucial to exercise. One, we're burning extra calories, but two, it's for our mental health and it's for our physical health, right? Get that blood pumping. So even if you can't do your 30 minutes a day, do 20 minutes. Do a high intensity workout where you push it for a minute and then do a slower for a minute and then push it, whether that's running in place really hard for a minute and then walking for a minute in place. So if you can't go outside because it's snowy and cold, then do it right in your house. Do squats real hard, lunges real hard, and then a little bit easier. I do a lot of, yeah, she's bouncing on her ball. I have a little mini rebounder and I run in place and have a treadmill. I make it my priority no matter what. And I would say wake up 10 minutes earlier and do your exercise, but make sure you're getting your sleep too. So you have to go to bed earlier. And if you're finding that you're too busy, you can't get to bed earlier, so then you can't get up earlier to exercise and you just can't get it in, take a look at your day and what is taking up all of your time and where can you come up with a few extra minutes to get a little exercise and do your quiet time. So I would definitely look for that. That's really important for the holidays, and the stress and the worry and the anxiety of the holidays will raise your blood pressure. So if you notice it going up, look at what you're eating and look at how you're living, and maybe you need some quiet time and to plan that. So
Right. Well, let's talk food, because you and we could talk food
we
all
do have
night.
to talk food.
So what are some good tips and some good recipes that you would recommend for, what do you like? What's helpful?
Yeah, I love food, and it's important. I think about what I'm eating for the holidays like 6 months in advance. I'm not kidding. And often it's just because of COVID, we haven't been traveling a lot and we're not seeing a lot of family, but it's my husband and I. So it's not like I have to cook for a lot of people, but I still make a big deal of it because I love food and celebrating and having that moment together. And so I always make a big salad. I believe in the importance of salad, and ever since I went plant-based for 10 years, I have a big salad every day. So I like a delicious salad. So we'll pick the sweet greens instead of doing like the bitter greens. Make a delicious big salad, put some pomegranate seeds on, some purple onions, maybe slices of pear. So it's a special salad, and make like a raspberry dressing or something like that, with a few nuts in it and some raspberries and a little vinegar or something pretty easy, but a special salad. That's not my everyday go-to salad, but this is a holiday, so I'll have a big salad so both of us can load up on that. And then we will do something like, we make a stuffing. We make it for Thanksgiving, we make it for Christmas, and it's made with white beans and cauliflower. And if anyone is interested, I can share the recipe. My husband came up with it, but it's got the sage in it, and it's got apple and celery, and it tastes like stuffing. It's delicious, and there's no grains in it at all, no bread. It's a completely whole food plant-based without any salt or oil or anything, and it's delicious. So we make that, and then we'll make a little dessert, maybe a little pie or something, a whole food plant-based recipe that I find usually online or from someone who's made it something. So, but it's special. Food is important to us, and we take the time to do it right. What about you, Jean? What do you like?
Gosh, the Thanksgiving and Christmas holidays for me, is family, and it's always those foods. I think of it as Thanksgiving foods, so I have a harvest cornbread. And again, if anybody wants these recipes, they can just message me. I have a pumpkin harvest cornbread, which is absolutely delicious. I love a cranberry orange relish the recipe is to die for. I mean, it is so delicious. Then of course, mashed potatoes and gravy, easy to do, to make it a healthy version and not going to be clogging your arteries and your heart, which would raise your blood pressure. So, I love that you put like the pomegranate seeds, which are great, high antioxidants. These, polyphenols that we get out of these are just, we want to eat from the rainbow. So, your salad is going to be this vibrant, piece. But I love having, like stuffing, and I make a bread stuffing, which is absolutely out of this world, absolutely delicious. So it's very, traditional foods, but sometimes I might take like pumpkins I bought little tiny small pumpkins and stuff those, with the stuffing in them. And, I cook them ahead of time, and then I stuff them and serve them. Oh, it was delicious. Or you can cut open a butternut squash and, or an acorn squash, and then just carve out and then put in the stuffing. Deliciousness. And that's
Wow.
easy to do because you can prepare it ahead of time, because that's like your centerpiece or your main dish. So really, really good. Chris, I think we can have some time for one question. What do you think?
Okay. Sounds good. And I would say for anyone traveling this year, spend time with family, do be careful with COVID. Right now, the hospitals are full again. And so when that happens, I get nervous that if anyone were to get sick, that I'm an ER doctor also. And so I talk to my ER friends and the ERs are busy right now. And there's like no room for extra sick people. So do take good care of yourself and do follow precautions. Hopefully your people are vaccinated. If not, social distance, wear your masks, be careful so that we don't get our elderly or sicker people, or us too. If we have medical issues, which you have high blood pressure, which you treat, and I have plenty of issues with my lupus, so I'm more than enough of my share. And so we have to be careful. So do be careful this holiday season. I wanted to add that to everybody's one more thing to think about, but we do have to think about it.
Mm-hmm. Absolutely. And if you're sick, stay home, please.
Yeah.
Don't go to don't go to grandma's house, please stay home.
This is a time we have to think of others. And there's so many people that are worse off, I think, and that can't handle getting sick with something like COVID. So we have to be careful. Mm-hmm. But I'm ready. If you have a question, we can take some.
Why don't you read it? And
okay.
We'll go from there.
The question is, somebody posted, anyone get nighttime sweats from medication? I'm on amlodipine and metoprolol.
Okay.
I know why you had me read it, Jean, because you can't say the word correctly.
Right.
I see how this works.
Right? She figured me out already. Okay. First, I got to jump in. You know me. I got my big mouth. I got to jump in first on this question. First of all medications, I don't care what you're on, is going to have side effects. Anything that you put in or on, let's not forget like body, hand cream, things like that, and lotions, shampoos, deodorant, toothpaste, anything that you put in your body, in your mouth, or on your body has to deal with. And there's going to be issues. There is going to be issues. The bigger question is, what effects is it having on your body? Because every person is going to be a little bit different. You may not have the same side effects as somebody else. You may have something different. And, apparently this person's getting nighttime sweats, and, there could be a variety of reasons. It could be, perimenopausal. You don't even know, that you're starting menopause. A lot is going to depend upon your age and all these other factors. We don't know enough about your situation to do this, or to talk about this, but every medication is going to have side effects. Just saying. Why? Right. Why not try to get off of these things and focus on lifestyle choices first? And I just got to put a plug in for you, Chris, because if anybody needs a medical doctor, she's it right there. She can, she's certified in 23 states and is going for 24. So she can monitor your drugs. She can monitor your, what issues you're having, order blood work and stuff like that. And then you meet and talk, and it's you have somebody who's so caring and knowledgeable about how to heal the underlying causes. That being said, let's just talk about how these two different drugs work on your body.
So what Jean said is correct. So, the goal is to not need medications, and if you're on them already, to need less of them or to be able to taper them off. However, I do want to point out that they both have important effects on the body. And so if you're currently taking something like, if you've had a heart attack, metoprolol has been shown to help prevent another one. And so what it does, metoprolol, is it's a beta blocker. So it blocks, there's alpha and beta adrenergic receptors, and the beta receptors are on the heart. And so instead of a powerful contraction, it's a slightly weaker contraction, just slightly, but enough that it protects your blood vessels so your blood pressure doesn't go up so high. And if you have damage to your heart, if you've had a heart attack, that actually can be protective. So it does play a role in some people. And the second thing that it does is, instead of beating so fast, it slows your heart down a little bit. And that's also protective. So it's very beneficial to not be beating so fast. So if you're on medications, please don't stop them because you don't want to take them. These are important. And actually the data suggests that if you've had the event, these are helpful, and there's certain people that it can help prevent an event. That being said, so can a clean, anti-inflammatory, well-built, well-constructed, whole food, plant-based diet. Over time, you no longer need those medications because your heart is doing that on its own, more efficiently contracting and slower. But that takes time. And so if you're already on the medicine, I urge you not to just stop it, but to work with someone who's knowledgeable and can help you, where you increase the good diet, the anti-inflammatory, powerful healing nutrients. And it's not just a plant-based diet. It's a clean, whole food plant-based diet that's got to be done correctly. And then the medication over time, you gradually decrease it till you reach a point you don't need it anymore. And that's what we're working towards for people. Or instead of needing a higher dose of it, you only need a very little dose of it just to give you that protection over time. And that's what we're going for. But what it can do is, in addition to all the side effects, so both medications can cause things like lightheadedness, dizziness, sweating, GI distress. They both can do that type of thing. Amlodipine can also cause heart to race as well. The beta blocker, which we just talked about, metoprolol, because it's slowing your heart down. If you exercise, when you exercise, your heart has to beat faster, right? Because it's got to pump blood to your whole body to sustain you while you're exercising, and it can't do that. And so on the metoprolol, sometimes people feel lightheaded or have a hard time when they try to do strenuous exercise, so they have to tone it down just a little bit while they're on the higher dose until they're able to taper it off. But people do taper it off. So we now know that with a healthy, clean diet and lifestyle, which is what we're trying so hard to teach you guys to really go for it, that you can work towards getting off of that. Amlodipine works a little differently. It's a calcium channel blocker, and calcium is needed to help the muscles contract, including the heart muscle. So when you block calcium channel blocker, by blocking it, it also slows down the contraction. So it works by a totally different mechanism, but it also has been shown to lower blood pressure, and it can cause a leg swelling. It can cause the palpitation. Sometimes your heart can kind of race or feel like it's racing. It can cause lightheadedness, but it does have benefits. If your blood pressure is high, you don't want to be walking around with a blood pressure of 160 over 90, 180 over 100, whatever people are walking around with. You do not want that. I'd rather you be on the medicine than walk around with that high blood pressure, right? But I'd rather even more that you work on your diet. Some people can get off the medications quickly, like really quickly. Other people, it takes time, and that's okay. Either way, we're working in that direction. And then over time, we slowly are able to cut out. So
I've seen people do it in as little as 10 days. 10 days.
I caution people. Whenever I hear those stories, I had heard that people reverse their lupus in a month or 2 months, and I didn't do that, and I felt so depressed. What's wrong with me? So I don't want to tell people you're gonna be off your meds in 10 days. But yes, it can be quickly. It can be a little bit slower. Either way is okay if you're moving in that direction, depending on how long it took and what's going on with your body. But when you really go for it, you get results, and it may not be as fast as some of the other people, but you'll get there. We can really help you get there. And if you're not, work with someone who's knowledgeable, who can help you troubleshoot it and get you there, because yes, that's your goal. And there's no reason you shouldn't be able to get there.
It's true. It's true. And once you can get off of these medications, oh my God, you feel so much better. I mean, honestly, when you start to get your health back, you feel amazing. The energy comes back. You feel good, and you just don't realize how long you've not been feeling well.
And there's nothing worse than being a victim of your disease. Like, we all want to take charge and have some control, and we can again with this. Yeah.
Right. It is. And it's easy to do without question. No ifs, ands, or buts. And that's what I love about this, because it's not something that is short term. This is a lifestyle. Okay. And once you can make this change and switch to it, it's just absolutely awesome. It really is. I mean, to know that you can eat as much as you want. There's no counting points or calories or carbs or whatever you eat, and just learn to eat foods that are going to help you to reduce the inflammation, the swelling, and bring down your blood pressure. And it's true, you can change this very quickly. And that's why you do need to have a doctor who knows about this, who knows and can see the effect. Because let me just straight up, guys, most doctors do not know about this, the power of food and the impact that it has on you, because they've not studied nutrition. Doc, when you went to medical school, did you study, like, for your first one? Did you start for emergency, your degree? I think you got that one first, right?
I got internal medicine first, and then emergency medicine. I did both, and then integrated.
For either one?
No, I did not. But that was so many years ago. So I doctors are always getting CME, continuing medical education. So I don't blame medical school anymore. I blame if they haven't been doing CMEs in it. updating their education over the years, then shame on them, because it's part of being a doctor and we should be learning that as well as learning about the medication. So yeah, no, it's not something that is taught all the time. And I would say, I'm an emergency doctor. I've used powerful drugs. I've taken, we've done surgery in the ER. We've taken people to the operating room. We've done pretty amazing procedures to save lives, but I've never seen a more powerful drug than changing your diet. I'm not kidding. I'm not kidding at all. As far as diabetes, as far as blood pressure, as far as inflammation, autoimmune disease, it's powerful. And that's why if you have high blood pressure and you're working with the doctor and you're on medications, that you have to work with the doctor, because it can drop your blood pressure fast and you get lightheaded, pass out. You can have a heart attack from going too low too fast, or a stroke. So there's a lot of problems from dropping your blood pressure too fast if you're still on medication. So that's where it's really important that you work with someone who can reduce those meds, be prepared, and watch for that and keep you safe while you're changing your life.
Because either there's two types of doctors. Either you've read the research or you haven't. It's pretty simple, right? Because once you start to learn the research behind this, it's like, then why are you still, and we know why. I mean, we've talked about this before, they've been trained to just write, and people have become trained to expect a prescription. Here's my prescription to handle this, whatever XYZ problem that you have. But we need to get to the root cause, because the medications are not going to help. So, well, Doc, always another great week. So thank you so much.
That was fun. I love the recipes. If anyone is interested, please message us, because we are so happy to share them. It's important to us, as you can tell, too, to stay healthy this holiday.
Right. The So thank you so much. I appreciate always connecting with you. And if you have anybody has questions, you can post them, in the high blood pressure Facebook group, the support group, and just tag me or Dr. Miller, and then we can get them into the show and answer your questions that way, or you can answer live. So either one, we're happy to do that. So, and if you're looking for someone who can help you holistically, that is Dr. Miller, without question. So I just wanted to put that plug in for you, Doc, because you are amazing. No ifs, ands, or buts. So, she's helped heal so many people with serious issues, so anyway.
Thank you. Great to see everyone tonight. Thanks, everyone.